All right, I'm calling this meeting to order at 11 a.m. on September 11th. Hello and welcome to the Texas Early Learning Council meeting. My name is Megan Schneider and at the Texas Education Agency, and I'm the Interagency Director of Early Childhood Support. Welcome to council members, welcome to staff and members of the public who are attending today's Texas Early Learning Council meeting. As I mentioned, I will be doing my best Reagan Miller today, who is the TELC's chair, but thank you in advance for your grace. So we are producing this meeting as a Zoom webinar. Council members, presenters, and agency staff are participating as panelists, while members of the public are able to participate in listen-only mode. Of course, please keep all your extra electronic devices on mute when you're not speaking, and I or Cindy, who's helping to facilitate today's meeting, will mute you if there's extra background noise. Please state your name before you speak. And there was an opportunity to submit public comment, as there always is at these meetings, which closed at 5 p.m. yesterday. Members of the public are still welcome to provide oral public comment today by emailing your request to me, megan.schneider@tea.texas.gov. Cindy just dropped the details about how to do that in the chat. And we will move on to our second agenda item, which is the June and July 2023 minutes approval. So because there were not enough people voting to approve the minutes in our previous meeting in July, we're going to be reviewing 2 sets of meeting minutes today instead of the usual one. So you can locate the June and July 2023 meeting minutes in your email that was sent by me this morning, or attached to this calendar invitation. So are there any requests for edits or changes to the June or July meeting minutes? All right, I'd like to request a motion to approve both the draft June and July 2023 meeting minutes.
This is Kathy Abba. I move to approve both sets of minutes.
Great. A motion from Kathy to approve the minutes. Any seconds?
I'll second. This is Kim.
Great, thanks. So a second from Kim. And that is a move to approve the June and July 2023 meeting minutes. I will conduct a roll call vote of the members that will also serve to approve the minutes or take a vote on whether to approve the minutes. So when I call your name, please reply for, against, or abstain. And I will say, if you were not present at the meeting, that doesn't mean you have to abstain from moving to approve them. So again, for, against, or abstain. All right. Kathy Abba.
For.
Sarah Abrahams.
For.
Weldon Beard. Carrie Breeden.
For.
April Crawford.
For.
Rochelle Daniel. Alfrema Giles.
Here, approve.
Melissa Hoising.
Megan, I was having a hard, this is Rochelle, I was having a hard time getting off mute, so 4.
Oh, great. Okay. Sorry, moving too fast there. And Alfrema Giles, I heard you're for. Melissa Hoisington.
Yeah.
I'll abstain due to being absent from that last one. Thanks.
Becky Huskuehler.
For.
Kim Coffrin.
For.
Tori Lee. Jerletha McDonald.
For.
Reagan Miller. Marcela Nava. Stephanie Rubin.
For.
Amber Sconlin. Kirsten Schwab.
For.
June Yeatman.
For.
Awesome. Just going to do a quick tally here to see if we got a quorum. Yes, and the motion to approve both the June and July 2023 meeting minutes has carried. Thank you all. So we'll move on to public comment. We did not receive, as I mentioned, any requests in advance, but just a reminder to everyone that the opportunity always stands to submit public comment. And the next one's coming up soon because our next meeting is this Friday, the 15th. We'll talk a little bit more about that later. But the details about where to find the meeting minutes are listed here. You can always go to earlylearningtexas.org in this section called meetings. So we will move on to our next agenda item. So as y'all know well, because it's been most of what we're talking about lately, the state was awarded funding for a 3-year federal preschool development grant for early childhood systems building. And 2 of the foundational activities for the state's work in year 1 in particular are an updated comprehensive needs assessment for children aged birth through 5 and their families, which will inform the second foundational activity, which is an updated comprehensive statewide birth to 5 strategic plan. So we'll be discussing the second strategic planning session during the updates from TELC members section of today's agenda. But right now we're going to turn to the needs assessment piece a bit more and hear a great update from our needs assessment lead, Dr. Dorothy Mandel, and her team, who are conducting the work in 4 phases and that are listed here on the slide. So for those of you who haven't tuned into all of them, the first phase was back on June 30th. She shared findings about the early childhood workforce. On July 21st, she shared findings about early childhood coalitions. Today, we'll be covering the 3rd and 4th of those pieces of the needs assessment, which are going to be the needs of families of young children, as well as data systems. And so we are very excited to turn to her. And again, this is just the initial findings. So this is not hard and fast, but we want to be sharing out information with folks as the information is becoming available. So Cindy or Kathy, if y'all could find Dorothy Mandel in that list of attendees and go ahead and promote her to a panelist, that will allow her to share. And while we are waiting for that, I will also remind everyone that all the rich information that has already been shared out from those first 2 rounds of the needs assessment is posted in the same place as all the rest of the TELC meetings, which is on the earlylearningtexas.org website. And so definitely encourage you to go there. Both the meeting recordings and slide decks are posted there. So Dorothy, are you able to mute and unmute now?
Yes. Hi,
Yay.
everyone. All right. Let me go ahead and share my screen. Cindy, we're going to have to quickly shift. Can you go ahead and share the presentation I sent this morning? My computer is not letting me share the screen.
No problem. That's probably a hosting, co-hosting issue. And you can go back 1 slide, please.
Yeah. Thanks, Cindy. I really appreciate it. So today we're going to be talking about the work that we've been doing centering around family needs. This has been a really interesting and eye-opening experience pushing out the survey throughout the entire state. And I just want to, before we begin, thank everybody who sent the survey out to families. The response that we have received has been really, really good and really fast, and we really appreciate all the work that's been done by the partners to push the survey out. So if we go to the next slide, Cindy, I also want to first begin by reorienting everybody to the model that we're using in the needs assessment in order to structure the needs assessment and help us scope in how we are doing our assessments with families, with the workforce, and with different coalitions across the state. So today we're going to be talking about families, and that is going to focus really on family outcomes, which is important for understanding whether they feel meaningfully involved and organizationally supported by the early childhood the early childhood system. The other thing that we're going to be focusing on is family and child well-being, because that is ultimately the outcome that we all want to improve through PDG activities. And just to reorient everybody again, when I mean child and family well-being, I also mean school readiness. I also mean better health. I also mean better development. All of those things are so intricately tied together that you can't really break one apart from the other. So family and child well-being really covers the entire gamut of those outcomes that we really want to assess and really want to improve through this activity. So on the next slide, I just want to begin by talking about the survey that we send out. So when we sent out the survey, it was, trying to keep it as short as possible for families. So we focus really on well-being and quality of life. There's a very rich literature, especially in the early childhood literature focused on disability and delay, early childhood disability and delay, focused on the importance of family quality of life. And we borrowed heavily from that literature to help assess family quality of life throughout the entire state. So what we're looking at when we assess quality of life is we're looking at the family's quality of life, is their ability to access their preferred childcare system, their preferred childcare setting. That is so incredibly important to families feeling engaged with the childcare system, but also families feeling like the system is supporting their choices. We are also looking at the impact of the family and children. That was an important aspect and a federal requirement for the needs assessment. And we want to understand how families feel coming out of the past 3 years, and also what the past 3 years has done to their family and to their children. We have also are assessing family quality of life specifically with a validated measure that's in the literature that's focused on 4 aspects of family quality of life. That's family functioning, so how the family interpersonally functions with each other, whether parents feel like they're receiving external parental support or not from the systems around them, whether the family generally has positive social emotional well-being, and finally, whether or not the family has material well-being, so they can meet all their needs. We'll go over these more extensively and the types of questions that led to these different aspects of family quality of life when we talk about the survey results. Next slide, Cindy. So what do we mean by meaningfully involved and organizationally supported? The biggest, most important aspect of this is, do families trust the child serving organizations that they interact with? There is such an important literature showing that without trust, if you don't have trust, they're not going to walk in the door. And if you don't have trust, you're not gonna be able to do anything. That the organization can't improve if they haven't won the family's trust. So with that said, I'm going to gloss over the trust results when we talk about them, and I'll explain why as soon as we get to that section of the needs assessment. But the other thing I want to really focus on is, do families see these organizations and providers as partners in whether or not in how they raise their children? And this can be divided. We're using, again, a validated survey that has been utilized extensively in the literature. And we're looking at whether or not families see these organizations as a partner in their child's development, and whether the family sees these organizations as a partner in their self. So I'll explain this more when we get to it, but this is generally how we're looking at whether or not families feel like they're meaningfully involved and organizationally supported. All right, so let's get into the results. So the family survey was sent out extensively across the state, and it was distributed through multiple state agency partners and different local community organizations. And again, thank you so much for everybody who forwarded it on the email and everyone who reached out to their families to get them to answer the survey. We have compensated families $35 for their time for completing the survey because we feel that they're providing their expertise and they should be compensated for that expertise. Children who were eligible and families who were eligible for the survey were eligible if they had a child who was younger than the age of 6 and they had to live in Texas. This is always a big issue when we have these huge distributions of surveys, is we need to make sure that our families are living in Texas. There's 3 exclusions that we had related to the survey. 2 of them were done automatically on the back end of our survey. So if they didn't meet these inclusion criteria, they actually weren't compensated for their time either. And that is somebody completed the survey too fast. I'm going to be honest with you, most of these surveys getting completed too fast are actually bots or scripts, are not real people. And the other thing is we have to exclude them if they didn't actually assent and provide assent to take the survey. We've also applied a 3rd level of exclusion, and that is on the back end of our data doing analysis. And that is that we're looking at whether or not the combination of services that the family said that they received, their income that they said that they had, and the disability status of the child, if that combination wasn't realistic, we went ahead and excluded them. For example, families who had incomes over $80,000 with only 2 children, families of 3 with income over $80,000 who said that they were receiving WIC and Medicaid. That's usually not going to be a realistic combination without a child who has a disability. So we went ahead and excluded those responses. All right, next slide. So this is the responses that we have to the survey as of Saturday night. And so these are the results that you're going to be seeing today. The survey is still open. We've actually received an additional 200 responses since I downloaded these data on Saturday night. So currently we have over 1,400 total responses. This map, the dots on the map show you where the zip codes are, where we're receiving responses. The colors on the background for the county show you how many households are in that county. So the darker blue counties are more populated counties, and the light yellow counties are our least populated counties. Of our responses, 80% were from metropolitan areas, and that means the entire metro area, not just I'm counting even outlying areas of the metropolitan area within the metro area if they're in an ACS or defined metro area. That's 80%. 12% were from micropolitan areas. And so micropolitan areas mean places like Fredericksburg or Paris, Texas. Jasper is another micropolitan area. These are more of our small town. They don't meet the criteria for metropolitan. And then the other group is 5% came from small towns. So this is really small towns that don't qualify for micropolitan. So they have populations less than 50,000. Places like Brownwood and Burnet, Texas, for example, are small towns. And then 1.7 are from purely rural areas. And this is like, I've heavy criteria for reaching rurality in this designation, but these are like our panhandle areas with the very, very light yellow counties are purely rural. So I'm going to say this too. This distribution is a really good distribution across our metropolitan and our micropolitan areas. And this is what we would expect based on how the child population is distributed across the state. So we're doing a really good job with these survey responses to actually represent the state. I'm also going to say that from the way when I talk to state agency partners, when you guys think of rural, it's these three. It's the micropolitan, small town, and purely rural areas is what you guys are really thinking about when you think about rural areas. And the metropolitan areas are what we normally think about as San Antonio, Austin, Dallas, Fort Worth, El Paso, Amarillo and Lubbock, and of course, Houston, Corpus Christi, and then the Valley area are biggest metropolitan areas. So we're pretty happy with how this distribution is going and how this distribution represents the whole state. All right, next slide. And this distribution across geographically across the state is reflected also in our distribution across our racial ethnic identities as well as income. We are seeing really good distribution across race ethnicity in alignment with what we would expect based on the child population. Our largest groups of responders are those who identify as Hispanic and white non-Hispanic, and these are right at 40% apiece, which is really what we would absolutely positively expect based on the child population. We are getting a very good response from our Black and African American population. This is actually higher than what we would expect based on the child distribution. So this is really nice to see. Our Asian populations are also responding at a rate that I would expect to see based on the population. And we have a very strong contingent of Native American respondents. And thanks very much to the Workforce Commission for doing specific outreach to the tribes in the state. So thank you so much. It's really paid off in the way that we see this distribution. So throughout this presentation, I'm going to show you everything broken up by income and by whether or not the child, the family said that they had a child with a delay or a developmental delay or disability. That combination of income and whether or not there's a delay or disability is kind of central to a lot of the work that's happening in the PDG. So all of our results from now on will be shown by these distinctions. All right, next slide, please. So let's talk about who responded and what kind of services that they're using. So we specifically asked whether or not families had used specific services in the past year. Our #1 service utilization is Medicaid CHIP, with this being around 56 to 60% of the respondents saying that they utilized Medicaid or CHIP in the past year. Since we did say in the past year, I'm just going to say, I don't know how many of these have since lost coverage, but in the past year, they've had Medicaid or CHIP, or the parent was on Medicaid about 30% of the time, which, like I said, is in line with what we would expect for this early childhood population as well. The thing that I do want to point out is our child care subsidy utilization is only around 11%. And this is a theme that is going to come up throughout the survey and throughout the results of the survey, is we actually think that there is a disconnect in terminology between the way families are understanding the services they receive and the way we talk about the services they receive, especially with child care subsidy, because the survey was pushed out very effectively through the Workforce Commission. So we know that there should be a lot more than just 11% of these respondents who are receiving child care subsidy. So that's an important point is aligning the way we talk about services with the way parents are talking about their services they receive. Next slide. So the first thing that I want to talk about related to family quality of life is whether or not parents and families are receiving the childcare that they want in the childcare setting that they want. So we're focused on child use and preferences, and we assess this through 3 different questions. One is, what type of childcare have you used at all in the past year? And this was a check all that apply. And then the next question we ask is, what kind of childcare do you usually use? So this is the like what you're using now and what you use most often. And then we asked the grand question: if money if money and availability weren't an issue, what type of childcare would you prefer to use? So this helps us understand whether families are using the childcare that they really want to be using. So next slide, please. So this is the type of childcare that they have used in the past year. And the most prevalent type of childcare that has been used is childcare centers, with over 60% of some respondents, especially in our upper incomes, using childcare centers. That goes down significantly. This is a significant trend. And it's actually a significant, I call it disconnection. A significant jump between those who have very low income and those in the 20,000 to 40,000 income. This is a significant change. But this is where we see also the rise and the utilization of Head Start or early Head Start. So between childcare centers and early Head Start for this lowest income, it actually matches our childcare center data for the upper incomes as well. So next slide. There's also something that I would also like to, 2 other things I would like to point out. And so one is whether or not they're receiving childcare in somebody else's home. So these are our registered or our licensed homes. And these percentages are much lower than what we would expect based on the number of slots available in registered homes. Again, we think that this is a major terminology difference between how families are talking about that type of childcare and how we as the state are talking about that type of childcare. So again, this is another one of those places where terminology may not be aligned between what families understand they're receiving versus how we talk about it. The other thing I would like to point out is parents providing their own care at home. So these are stay-at-home parents. This is pretty consistent across the incomes. And what is very consistent about this is that if there's a child with a delay or disability at home, they are significantly more likely to provide childcare at home. And be it at least one of the parents stay at home or a combination of the parents staying at home. All right, I'm going to pause here. Stephanie, I saw you had your hand up.
Yeah, thank you, Dorothy. Maybe you mentioned this, but on the income categories, is there any important distinction or change that happens between the families that might be eligible for subsidy and then that like next income level of family that is not eligible? Like, where are their children? Is that what grouping is that, you think?
That for that, the grouping, that's a as I've been talking to TWC about eligibility for the subsidy, it's not as an easily identifiable cut point on income as, for example, Medicaid utilization is. So for example, for most of these respondents, because most of our respondents are families of 3 or families of 4. So for Medicaid, it's easy because it's anybody under $60,000. Those families with under $60,000 is where we'd expect Medicaid. For subsidy, we expect them to be in that same age range, but there's other factors that determine whether or not they're eligible for the subsidy or not. Like both adults need to be working, or they need to be in school, stuff like that, Stephanie. So we're
Okay.
working to figure that out.
Okay, and then and I see there's a question in the chat too. Yeah, I mean, it's always interesting to see, and I don't know if you get at this, of families who are eligible for subsidy but don't have a spot where they're finding care or what they're doing. So that's a question. And then my other one was on a previous slide, but we can talk about that later, which is on the Medicaid enrollment is, that was somewhat artificially boosted over this last year because of the public health emergency. So I don't know how much those numbers will change once the unwinding happens. And I don't know how much that matters to the data, but I just wanted to mention that the percent of parents and kids covered will probably go down to some degree.
Yeah, where I expect that to go down is on the parents covered.
Yes.
The 60% is not that far off of what we have seen historically.
Okay.
What I do worry about is it's going to go down because of the re-eligibility problems that have been brought up.
Right.
But I expect that once that's taken care of, that should be 60% again, because we included CHIP in there too, Stephanie, because I've learned from the past that sometimes people don't know if they're on Medicaid or CHIP. There's not much distinct. That's again, a family is just like, I'm receiving health insurance from the state. So with those put together, and especially that age range, that percentage, I see that in alignment. But the parents, that's much higher than I would expect to see.
Yeah.
So there was another question about whether there was a distinction made between two-parent households and incomes versus single-parent households in terms of who's using what type of care. The answer to that question is no, we haven't delved into that yet, especially on the two-parent households. Our focus on this was really household size and understanding the household size related to these income brackets, because that gives us a really good understanding of what people are eligible for. But that's something that we can delve into a lot more when we do the write-up for the needs assessment as household, single parent versus two-parent households. Because I can tell you that's coming up. That issue in particular is coming up in the comments that we've received back from parents. Do we have any other questions?
Hey, Dorothy, just one other question that came in the chat, a general one about this survey itself and whether it's still open.
The survey is still open. We'll keep the survey open until we received 2,000 responses. So based on the rate at which we're getting responses, I'm guessing we're going to close the survey probably at the end of the week. So push it out still so we can close the survey at the end of the week. All right, let's go ahead. And we'll drop a link to the survey after the presentation. All right, so that's the different type of childcare settings that people are utilizing. And I can tell you based on the percentages, people are using multiple childcare settings in multiple places that they're receiving childcare. So it's not just in one place, but it's a combination of things that they're utilizing. So when we talk about the most usual childcare setting that anybody is receiving, our results really match and follow the same pattern as we saw before, with the highest utilizations being in childcare centers. The next highest utilizations, especially for our lower income families, being within Head Start. One of the things that we see very clearly is the staying at home issue is much more likely to happen if a child has a developmental delay or disability. And this isn't surprising. This is well established within the children and special healthcare needs literature, that parents really feel like they need to stay home with their kids, either because the child's needs are such that they need constant care, or because their lack of accommodation, of finding a childcare center that it can accommodate them. Our lower income families are utilizing Head Start at a really nice rate. But as you see from this graph, that really drops off quite a bit as incomes increase, which can be another place of improvement, because I know that Head Start, these slots for kids in Head Start tend to be prioritized, especially for developmental delays. The other big thing is, like I said, parents are staying at home. Let's go to the next slide. So this starts getting into the interesting question of if everything was okay, if you had everything that you wanted to have and everything was available and you had the pick of what you want, and cost wasn't an issue, what would you want? And across all incomes, the number one response is a child care center. Most families want their children in a child care center, or especially with lower income families, they want their kids in Head Start in particular. We see this definitely happening with our families with delays or disabilities, is while they are utilizing stay-at-home options significantly more than families without a delay or disability, they actually don't prefer that at a higher rate than what you see their preference for other childcare settings. So within the lower incomes, even those with a delay or disability, who have a child with a delay or disability, they either want overwhelmingly a child care center or Head Start. And this is true whether there's no delay as well. The interesting thing that is popping up in this data, which is really interesting and surprising, is those who would prefer public pre-K. And what we see is upper incomes actually would prefer public pre-K, have a high preference for wanting to have public pre-K. In fact, their preference for public pre-K is significantly higher than lower income families' preference for public pre-K. That is something that we can all chew on and think about, but in particular, we're very much seeing this happen and coming out within our data. So when we look at the overlap between what the ideal is and what you have, the biggest overlap is childcare centers. Those who really, really want childcare centers, 77% actually are in childcare centers. Where we see it going down quite a bit is in public pre-K, and that those 53% that prefer to be in public pre-K are actually in public pre-K. And that has a lot to do with upper income families with like and prefer have actually a strong preference for public pre-K, but obviously are not in public pre-K. The other disconnect that we see is within Head Start, that only 31% of those who really want to be in Head Start are actually in Head Start. So what this is showing is a demand disconnect between what kind of childcare people are utilizing versus what kind of childcare settings people really, really want. Stephanie.
So I guess a couple of things that came to mind for me, and tell me if that seems reflected, is the really interesting choices here by parents of kids with disabilities. And I think, a lot of folks have thought about how important it is to, improve services in, and inclusion in childcare for kids with disabilities. And that's why a lot of families do choose public pre-K for, some of those services that are more kind of structured need improvement also. But I think, it's interesting for families who have a child with a delay or disability, if they're not eligible for public pre-K or Part B services, there's this big question of where they're no longer eligible for ECI. And then they're no longer, if they're not eligible for public pre-K, it's kind of a question about where they do get services if they keep their children at home. So that just seems like a big kind of interesting gap to explore, or try to figure out what those families need. The other thing that struck me is that we have ideal childcare settings, and there's also reality in there too. Like keeping my child at home without a paid leave program, or without some assurance that I can get my job back later, is a different question than like, do I just want to try to struggle on one income and keep my child at home? That's kind of like ideal within our current practical, world, as opposed to if I had paid family leave, then I might make a different choice about keeping my child at home. So just kind of just thinking about the way you're presenting it as ideal. I wouldn't want the like stay at home choice to seem a lot lower, just because we also haven't given the ideal situation of like, you can get your paycheck for a certain number of months and get your job back,
Yeah. I mean, that's always like the issue with ideal of like, if all these things were not an issue, that's how we asked
Yeah.
it. If income wasn't an issue, cost wasn't an issue, availability wasn't an issue, what do
Right.
you really, really want?
The other thought I had about public pre-K is that for certain income levels of families, they probably really need the full working day that childcare
Yeah.
provides. We require full day for 4-year-olds, but not for 3-year-olds in public pre-K, but full day is not a full working day.
Yeah.
So again, the upper income families might choose public pre-K because, 8 to 2:30 is fine. But for, other families that can't take the afternoon off or figure out how to cobble together. So there may be a little bit of distinction there about why families choose childcare. Which to me is exactly why Kim and, myself and lots of people on the Early Learning Council are really working towards pre-K childcare partnerships, so families can choose and also, their option, and also still manage to get a full working day of support.
Kim?
So I have a question and a comment. The comment is, it's very interesting on the 60 to 80,000 income bracket, and that's where the biggest pre-K push is. And if you think about the TWC childcare subsidy benchmarks, that's the population that may not qualify depending on their size of their family. And it's really hard to pay for childcare at that range, right? So 80,000 and up, it gets a little easier to pay for childcare. It's still hard, but so it's like that middle income that I don't qualify for childcare subsidy, but I can't afford childcare, and that's where they need the pre-K. So that's just an observation piece to me, is like that's that cliff of when you no longer qualify. And the second was a question, Dorothy, and I don't know if you had collected this information. Did you collect ages of children? Because it'd be interesting to see if like infant toddler care priority, like to piece it out, like infant toddler, do they still is child care center still the number one place, or is home base or staying home a higher priority for the younger ages of children versus the 3, 4, and 5-year-olds?
Yeah, so we asked for age only of the youngest child.
Okay.
They can do that with the youngest child, and that's a really good point, Kim. That's something that I have been thinking about, is do these change based on the age of that youngest child? We only asked for the age of the youngest child, and we asked if they had how many children under the age of 6 they had.
Okay.
So that does get at that a little bit, so we can explore that in the full write-up of the needs assessment. And to go back to your first point, I wholeheartedly agree with you. This is the childcare cliff, right? Where this is where you have to pay for it by yourself, and this is taking up a huge percentage of your income right here. So to go into public pre-K, and then yeah, you pay for the extra time after public pre-K, but that's
Still less,
loads cheaper.
right?
Somebody who's doing this, my kids are not in pre-K anymore, but that after school care is a lot cheaper than childcare is. So this is a major push for savings for these families. Absolutely, I 100% agree with you on that, Kim. But with that said, we also said this is the most ideal situation, and I have
Right.
to put that in perspective too of the ideal situation being that. But I can tell you, as we've been receiving data, the percentage that keeps fluctuating is this above 80,000 group, and their wants for public pre-K. I can tell you last week on Friday, it was a much higher percentage, and that percentage is going down a little bit, but where it's going up is in the childcare centers.
Yeah.
And the other thing that I want to point out is with this upper income group for childcare centers, let's face it, most of them are in childcare centers that are practically pre-Ks anyway. And there's certified childcare centers that are going to be those public pre-K partnerships. So the quality that they have access to in the childcare centers and what they think of and conceptualize is not just taking care of my kid, but also educating my child. So I want to put that out there into the world as well, and to interpret this.
Thanks, Dorothy.
Thank you. And Tim, I do want to point out the comment that Tim made in the chat. As more school districts move to 4-day weeks, this will potentially have an impact on the choice of public school pre-K because of the secondary care available on Fridays and the cost associated with that. And I do want to say this exact issue came up a lot in our comments that we received back from our parents. There are several parents who are in a 4-day-a-week situation and do not like it. They have a hard time with the 4-day-a-week situation. It's disruptive to their work schedule. They think it's disruptive to the kids. And so this is a big issue on the 4-day work schedule, and has come up in the data. All right, let's go ahead and go to the next slide. So we also asked families how satisfied they were with any of their out-of-home childcare arrangements. So anybody who wasn't staying home with their child as their usual way of childcare were asked this question. And I have to say that satisfaction with out-of-home childcare arrangements are actually really, really high. This is on a scale of 1 to 5, and most everybody really likes their child care setting arrangements, except for cost of care, which I know that's a shock to you. So we did look at this by the type of childcare that they said that they were receiving, and the only one who shows dissatisfaction, or who shows satisfaction with their child, their cost of care, is those who are in Head Start. And those who are in Head Start have really high satisfaction with cost of care. And so Stephanie, I think this, and Cam, this gets back to that conversation we're having about public pre-K, is the cost of public pre-K. That is also something, even those who are in public pre-K also are dissatisfied with their cost of childcare. And I think that has to do a lot with the supplementary childcare arrangements that you have to make in the public pre-K settings. So that lends a lot of credence to what we've been talking about with that public pre-K.
It's interesting, Dorothy, to see. I'm happy that people are overall very satisfied. I think people tend to feel like so grateful that they get a spot too. So,
yes.
But also, I think in the education world, the polling generally shows people are happy with their school, but they think like the educational system needs
Yes.
fixing, or they're maybe unhappy with the district, but they like where they are because there's an attachment and known thing to it. So, you know, that may be at play too. You appreciate where you are, but you may feel like it was the only good place I could find in the whole community, you know?
Yeah, absolutely. And I found the best thing that was available to me. So I'm going to be satisfied with that. Absolutely. And there's a lot of variation that we have in these responses too. And so that's something that we would like to get into a lot more, is what the source of this variation is and some of the satisfaction scores. Rochelle?
Yeah, hi. I was going to ask a little bit too about how much consideration um, was given to the source of where this person got access to the survey. Because I do know that we worked with our childcare providers to ask them to distribute. So I also wonder if that might lead to more people who are using a program that they're satisfied with, because that means that program was communicating information to them. You know, like there might be some skewing that happened because, okay, it was surveys were going to parents who are using centers who are communicating with them. And so, I mean, I don't know how we could account for that, but just wanted to point
Yeah.
out too.
Yeah, we did not ask for who they got the survey from. And I can tell you that childcare centers did distribute the survey a lot, just based on what we have, but also ECI distributed the survey a lot. And it was distributed a lot through other routes by which families are not just in that setting. Otherwise, we wouldn't have such high percentage of parents staying at home, especially among those with delays or disabilities. So I completely acknowledge what you're saying, Rochelle. I'm just not 100% sure if that's really what's at play. I think more the psychological need to be satisfied with what you have is what's at play in some of these data.
Yeah, absolutely. Okay, well, thank you.
All right. Yes, and other people in the chat have been making comments about the My School. We see this in the trust. One of the reasons why I'm not presenting the trust data, we see this in trust. Anytime we do trust metrics, of if you ask somebody about your general feelings about healthcare, their ratings of trust are much different than you ask them about, well, tell me about your pediatrician. Well, my pediatrician is awesome and amazing, but healthcare, I don't trust them. You see the same disconnect of the choice I made is the choice that I'm going to continue to make. But the system, my feelings about the system are a lot different. And I think that this satisfaction really reflects, this is the choice I made, so I'm going to be satisfied with that choice, except for when it comes to cost, because I don't have much choice. All right, let's go to the next slide, please. All right, so one of the things that we wanted to understand is also how families are perceiving the impact of COVID on their children and on their family generally. Of course, COVID is an acute stressor event, but there's all these other stressors that surrounded the last 3 years that were experienced at a much higher rate than we would have experienced them without COVID. So we specifically asked families about their acute stress, any acute stress that they experienced during those times. And then we also asked them to rate on a scale of 1 to 20 about how COVID impacted them, whether they feel like they're doing better now or they're doing much worse now than they did during that time. And so what we asked them about is their overall health, their child's social development, their child's learning progress, the child's overall behavior, and whether the family is generally better off now than they were before. The other thing that we did is we asked them, this is one of the places that we provided families the opportunity to write in responses. And I can tell you that families wrote in responses. and what does your child need to move forward from COVID? And we'll go over some themes that we're seeing out of that data as well. So let's go ahead and talk about acute stress. I'm going to go to the next slide. So these are the events and stressors that our respondents said that they experienced. Almost a third lost employment or began, and then another third began a new job. So I'm hoping most of those who lost employment began a new job. But both of these were experienced at because we have such a large number of families, both of these are experienced at a significantly higher rate if there is a child at home with a delay or disability. They experience loss of employment and beginning a new job at a much higher rate. Also, these families also experienced no child care for more than 1 month at a significantly higher rate than families who did not have a child at home with a delay or disability. This one in particular, we're hoping to delve into that a little bit more. Also, slightly higher rate of death. They experienced a death of a close person. And I do want to say and put this in perspective, these are families of young kids. And these families of young kids, almost a fifth of this sample said they lost a loved one during the time. That is a lot of loss and grief within the sample. Not just the loss of employment and the stress associated with that, but a fifth of them lost a loved one during the time. The other thing that we see is about a quarter of all respondents, and this is not a significant difference between the two groups of families, but a significant number said that they're making less money now than they were before the pandemic. So that's a big chunk of families who have been impacted by really acute stressors during COVID and long-term impacts of COVID on the families. And as you might imagine, with making less money now, experiencing the death of a close person, the stress of beginning a new job and changing employment or losing employment, that leads to painting a picture. We have a big chunk of families that are served by the early childhood systems who are going through a lot of stress and a lot of grief, to put that in perspective. And
Dorothy.
sorry, just checking. Go ahead, Kim.
I was processing that, and I think about the workforce survey and the need of the challenging behaviors.
Yeah, I'm gonna get to that.
The correlation between those two and how we who know child development, who live and breathe this space, can make that connection, but the general public doesn't make that connection, that there's a lot going on with these young children and these families, and they're just trying to survive. So, and how do we help bridge that gap and make those connections? So
yeah, absolutely. And we're going to get into that data. Families are recognizing this connection. So we're going to get into that data in just a second, actually. So let's go to the next slide. So one of the things we asked is what their perceived impact of COVID was on their child's health and their child's behavior. And generally, most families said that their children are actually healthy. Healthy now. COVID wasn't necessarily a bad thing, and the kids are doing really healthy. However, I showed these box plots so that you guys can see the entire range. Our entire range goes across the entire range of 0 to 20. So as you see from these upper whiskers and lower whiskers on these box plots, that means that we have quite the range of responses happening across all incomes and across delay or disability status of whether or not they feel like their kids' health is better now than it was before. Now, when we talk about child behavior, we left this open and vague on purpose to talk about behavior because this is something that came up in the workforce survey. Kim, as you were alluding to, is the behaviors that they're seeing coming through, not necessarily social behaviors or emotional behaviors, but any behavior. And one of the things that we see is those who had a delay or disability, who have a child with a delay or disability, feel like their child's behavior is significantly worse off since COVID than those without a delay or disability. That difference between those two groups, regardless of income, is a significant difference. So if we get into some more nitty gritty about behavior differences, let's go to the next slide. This is where we really see the changes of how parents see the impact of COVID on their kids. And once again, I just want to point out the extreme variation that exists in all incomes and all disability statuses across this entire survey. So one of the things that we see is that children, families definitely viewed COVID as having a negative impact on their kids' social development. And this is especially true if the child had a delay or disability. These are very significant differences between families who have a child with no delay or disability and families who have a child with delay or disability. The other thing that on average, almost all families were either neutral or negative about the impact of COVID on social development. Like I said, we have a few stragglers out there going, my kid's awesome. But most people were saying that this is either neutral or a negative impact on social development. If we talk about children's learning or progress in school, this is the other place we see a significant difference, no matter the income level, that if the child has a delay or disability, the family view COVID as having a negative impact on the child's learning or progress in school. Within this, one of the other things that we see is throughout our income classes, upper income families are a little bit more likely to say that COVID had a negative impact on their child's learning than lower income families when there's no delay or disability within the home. So I'm going to stop there and give you guys time to reflect and make comments if needed on this. Tim, I do want to talk about this. Often parents with children that don't have a diagnosed delay or disability report they don't see a change in their behavior at home versus the negative behaviors we may be seeing in our centers. We're going to get into this in the comments that families made because I actually think that families do see this and very much are talking about seeing this. And this, your comment, Tim, in particular reflects one of the things that we're seeing that parents are discussing is that just because there's not a diagnosis of a delay or disability doesn't mean that there's not a problem. And this is something that parents see in conflict, I think, with their childcare settings. So let's go on to the next slide because the next slide is a little bit of a summary of the comments that we received from families and three major themes that we're seeing coming out of the comments from families. One is about social emotional catch-up. And this was a very, very, very common comment that families made is talking about how their kids just aren't interacting with each other the way that they would expect them to interact. This is a very specific quote. My almost 3-year-old is rarely around any kids his age, and it has been a struggle trying to teach him the right things, such as potty training and learning to share. just the readjusting to life after COVID has just been very hard on the kids. They don't have social interactions. They had to uproot their lives because of the shutdown. So they've had it really hard. And this is a really common thing, a common comment that we got is that she just needs to express her feelings more. She doesn't always let her teachers know when something is wrong. This lack of expression that kids are having with other adults in their lives was another common thing that came with that social emotional catch up. One of the things that also came up is families recognizing the lack of accommodation. And this accommodation is not just accommodations for families who have a child with a delay or disability, but a lot of families, especially families whose kids are struggling, are talking about these accommodations. My child's biggest need is just to have a caregiver who understands the world she was born into and how to have grace for children as they try to understand it. This became a big theme, especially among families who did not have a child with a delay or disability, that they felt that the child care centers could do more to help their kids catch up and could do more to understand that the added I just got a comment yesterday that kind of sums it up nicely of what does moving forward look like as opposed to thinking that things are going to be the way they were. And it was a very pointed comment from a parent who answered the survey last night of it's not about what it used to be, it's about what it is now, and feeling like adults don't necessarily isn't adjusting to where their kids are. Their kids are living in this normal. So the other accommodation that came out is access to childcare for neurodiverse students. Our school and our childcare facilities cater to normal kids. They don't have the training and the ability to accommodate kids who have ADHD and other developmental delays. And from this comment also comes up not just accommodations for physical disabilities, but those neurodiverse disabilities in particular. The other thing that came up is consistency. A lot of people talk about childcare turnover and how that's impacted their children. And having consistent caregivers and providers. My two children are attending a preschool that pays better than most other preschools and ISDs in the area, and turnover is still an issue. This came up a lot in the comments related to consistency, whether that's consistency and just having adult consistency in the child's life. There are a few families who actually made this connection and the lack of consistency being related to problems with their child being able to do social emotional catch up within the child care centers. The other thing that came up in the consistency too, which is just something to chew on, is somebody brought several families, especially families with children with developmental delays or disabilities, really talked about the need for professional consistency. Some made comments about high school kids can't take care of my kid. And having that professionalism in the child care center, that knowledge going in and that knowledge being consistent, not just having a person being consistent. So let's go to the next slide, please. So the next thing I want to talk about is family quality of life, and everything that we talked about before when it came to family satisfaction is going to play into family quality of life. And that a lot of people are going to say nice things about their family. But this measure has been a great measure to utilize. It's a measure of resiliency and support within the family. It's heavily utilized. The exact questionnaire that we're using is heavily utilized in the developmental delay and disabilities world. And so it's actually nice to have these data. What we're looking at, to go back, is interactions with how the families interact interpersonally, their external parenting support, their emotional well-being within the family, and the material well-being within the family. All right, let's go to the next slide. So family quality of life. So we're going to first focus on family interactions and parenting support. So there's not a lot of significant difference as far as mean or median responses go when it comes to income or delay or disability. But what there is a significant difference on is the amount of variation across all of our income groups. So lower income groups tend to have more variation in how they responded to this survey than upper income groups. And that is true when it comes to the family interaction, so how well the family interacts and supports each other, and also when it comes to external parenting support. There's a lot of variation in how families are responding to this survey, even though on the mean, on the population level, there's no difference between income or disability status of the child. And I'm going to come back to this in just a second. And so let's go to the next slide. And so the same is true when we talk about emotional well-being and, shockingly, material well-being. Material well-being was not significantly lower for lower incomes than it was for upper incomes. And I think a lot of that has to do with people are like, no, I'm going to make it. I'm going to be fine. And we're going to make this work. But the variation for lower income on these responses is much higher than it is for upper income. Again, we're not seeing any significant differences between whether or not there's a child with a delay or disability. This to answer Lynn's question, she asked, what was that in comparison to how the family felt about quality of life questions pre-COVID, or not relevant to the pre-COVID questions? It's not relative to the pre-COVID questions at all. In fact, it asks you about how you're doing right now. But I'm going to get into its relationship to some of those pre-COVID questions in just a second, statistically. But as the family was answering it, these are independent questions that they answered. Let's go to the next slide. So now I want to get into those outcomes and talk about how families feel they're meaningfully involved and organizationally supported, and kind of bring together what we're seeing on the COVID side, the family quality of life side, and these meaningfully involved and organizationally supported measures that we're asking families. So one of the big questions we want to ask is whether or not families see organizations and providers as partners, whether they see them as partners in helping their child, and whether they see them as partners for helping their family generally. And like I said, there's also these trust measures, but we're not going to go into the trust measures that much today. So let's go to the next slide. So family provider partnerships go into a couple. I'm just going to focus on two different things, and that is whether or not they think that the partner is actually supporting their child, and whether or not they think the partner is supporting themselves. And this is a very similar story to what we saw in family quality of life, that there's not significant differences across incomes, nor are there significant differences across delay or disability status, but there is substantially more variation in how families answer these questions in lower incomes than there is in upper incomes. And this look, the reason why I'm not showing you trust is this look is the same that we see in trust. So I would just be showing you the same things again, to which you would probably look at them and go, Dorothy, you just changed the title, because the graphs look almost exactly the same for trust. But what I wanted to point out is there is an important relationship between all of these measures. And so let's go to the next slide. And that is that trust and family partnerships go hand in hand, especially if there's a child with a delay or disability in the home. So the lowest trust measures that we see are the lowest family partnership measures that we see. So even though both of these measures are really high, if somebody is not feeling that they're trusting their childcare center and childcare in general, they also aren't seeing them as partners. The other thing that we see in the partnership data is that the child-focused partnerships are what really matters. That is what we see that's related to trust, and that is what we see as related to family and quality of life. That the parent and the family-focused trust measures aren't that related to the two either. And the other thing that we see with child-focused versus family partnerships is people tend to be a lot more critical when it comes to the child-focused measures than they are on the family partnership measures. So our key takeaway here is that it's great to include the family, but you have to change the way you treat the child. That including the family without improving the way the child is cared for isn't going to do a lot to raise trust. It's not going to do a lot to make the family feel more involved, and it's not going to do a lot to increase family quality of life. I'm going to pause there because that's a lot to chew on. Anybody have any questions? Need me to go over that again?
I was just gonna say to say it one more time.
Yeah. Yes, it's a lot to chew on. So when we ask families about how well they interact with child serving institutions, we can break it up to how well that child serving institution is supporting the parent, which is the family, the parent, or how well that parent sees that that institution supports their child. That institution, how well that family sees that that institution is supporting their child is what's related to whether or not that family has trust in that institution or not. I think it's important when we talk about family involvement to talk about this, is that family involvement by definition has to involve families coming in and talking to you. That's not going to raise trust based on the data that we're seeing here. That's not going to raise trust in that institution if it doesn't result in change of the way that institution interacts with kids. Does that make sense, Kim?
Yeah, I think it does. I mean, I think it seemed, I'm thinking about you, June, you know, in the classroom and dealing with children and like, and back when I was a childcare provider, like there was always challenging parents, but if we had the relationship with the child, we could always work through whatever, you know, missing sock or lack of whatever, you know, whatever happened. If the relationship and the bond was with the child, and if we knew that we were putting the child's needs at first, I'm thinking of talking to parents who are angry about the biter in the classroom and putting the child first. That's where the relationships come from.
Yeah, definitely. Sarah?
Hey, I mean, this is surprising to me that this, but I wonder how different it is in initiatives or activities that are not meant to be child specific, like that are meant to be family specific. And I'm thinking about like home visiting and family support and family resource centers and those other kinds of early childhood that are not necessarily about care that is taken of the child outside of their time with the parent, and how this issue of trust and engagement is different or the same with those. Because I hear what you're saying. I'm surprised by what you're saying, but I think it's only because my perspective is not from a childcare or an education setting. It's from something different, and that doesn't seem to be what we hear from families when we ask these same kinds of questions. So I'm wondering if that's the difference.
I have been wondering the same thing, Sarah. And part of me thinks no, it's not different. Part of me thinks that family resource centers, while you all may think you're serving the family, they think their children are being served. That they think that is a great place for their kid. That is a great place for their child to be supported, and that is a great, by supporting them, you're supporting the child. So many comments that came through about people who receive services. It's in service to their kids, and recentering that too. I think that goes back to one of those disconnects of how we think we're serving people versus how families believe and why families are accessing those services, and they're accessing those services for their kids. Does that make sense, Sarah?
I mean, it makes sense what you're saying. I'm saying that we haven't gotten the same results from similar conversations and surveys that we've done that have been more specific to the kinds of services that are provided outside of an early childhood child care education specific setting. And so, I mean, I hear what you're saying, but I just we haven't gotten that same response.
Yeah, and I think that might be also an issue of how those questions are asked.
Could be.
And who's asking those questions and the context in which they're being asked, of course. And this might be a good situation for us to then to align metrics of how these surveys are going out, and where that trust is coming through and where that partnership is coming through. Because I don't want to discount helping families. You need to help families. It's just one of those things where in these data, helping just being completely adult focused without changing the way that the child is interacting with society or helping the child along, that's not necessarily going to go as far. And that just comes out in these data. So this is one of those places, Sarah, where we definitely can align metrics and we can do a better job of aligning what's happening. Because I'm going to be honest with you, Sarah, we see this in home visiting. Our interviews with home visiting families have said, no, my child is the client. I'm not the client. My child's the client. I mean, my child's receiving home visiting. I'm not receiving home visiting. It's for my child. So these kind of things are coming up in our data, just also in our home visiting data. So it's a good place to talk about it. Talk about how you guys are asking these questions and talk about how we're asking these questions and aligning, because I don't think either one of those responses are wrong. But the recognition of re-improving things for the kid is what I just want to recognize with this. So the question was asked about if there's variation in trust in childcare for child or in between in-home or center-based care. We can look at that, Stacy, and we haven't looked at that yet. That's going to be our next step, is for those who are receiving center-based care or Head Start, do they have higher trust measures than those who are receiving other types of childcare? And so, and Marcella made a comment too, that the child will definitely let the parents know if the program is trustworthy. Yeah, the inclusion of the parent is incredibly important. You have to include the parent. And I'm not saying don't include the parent at all. I'm not saying that at all. I just want to say that it's important to consider why you're including the parent. And Tim, no, there were not examples of provider family partnerships that were provided in relationship to this question. These questions are a series, there's a series of questions related to how well you interact with that provider and whether or not you believe that provider, these are all different types of partnerships. that they could have. So this is a validated metric that's used in the literature. So it's just doesn't ask you outright. It's not going to ask you outright, hey, do you get along with so-and-so? But it does get at these issues related to partnerships and what a high quality partnership looks like. All right. Other questions or comments? All right, let's go to the next slide. So, we need to wrap it up. So to summarize, if there's a family, the family needs that we're seeing when there's a child with a developmental delay or disability is that getting extra help into the preferred, they need extra help getting into their preferred childcare arrangement. That comes out very clear that in particular, if there's a developmental delay or disability, those families are not in their preferred childcare arrangement. They in particular need consistency in the professional early childhood hood workforce. And this comes out a lot in their comments and their additional needs related to what they see that their family and their child needs moving forward. They also need an early childhood system that is a partnership with the child, as we've been talking about. And these families in particular probably need a lot of emotional support for the families based on what we're seeing related to their acute COVID exposures. These families in particular have gone through a lot of upheaval during the past few years. So if we go through the next slide, if we look at family needs related to generalized family needs, we see that once again, these families need help getting into their preferred childcare arrangement. Whether that is whether that is a barrier of cost, which we know is a barrier of cost, and a barrier of accommodation and availability. There is a disconnect between what kind of childcare arrangements they have versus what kind of childcare arrangements that they say they would want to have. These families really are calling out for more social and emotional developmental support for their children, even those without diagnosed delays. In particular, we see those comments in particular coming up a lot, especially in families who don't have a child with a diagnosed developmental delay. The other thing that they are asking for as well is consistency in the child care workforce. That definitely is something that came up in the comments. And as we saw with the others, they want an early child care system that is partnering with their child. Families that have hard experiences during COVID have the lowest family quality of life now. And that is something that I want to emphasize related to that variation that we see in family quality of life and the variation that we see as well as in the family partnerships survey, is that the families who had really hard experiences during COVID, who felt their kids really suffered during COVID, these are the families that have the low family quality of life. And these are the families that we're seeing that also have low ratings for partnerships, family partnerships, and child-focused partnerships. So this is definitely something that we want to think about, especially in addressing what is probably a lot of unaddressed grief and trauma that is happening within these young families. So Sarah, what do they mean that social and emotional developmental support for their families? They believe their kids are behind, and they believe that the systems aren't helping their kids catch up. So
but what is that? I'm just trying to get my arms around, like, what does that mean to them, that they feel like their kids aren't on the right developmental track based on their understanding or based on so what they're asking for is additional socialization for their kiddo in these more organized environments.
Yes.
Gotcha. Okay, thanks.
Yes, that's what they're asking for. They don't feel like the environment now is enough to get their kids back on track. That's what we see definitely coming out of the comments. And you know, that also, I believe Tim's making this comment in the chat as well, but that corresponds to what we see in the workforce survey as well. As the workforce is also saying these kids are behind developmentally, they're behind social emotional developmentally as well. And it's the biggest need that we see in the workforce survey. So this actually is convergence of evidence between what families see and need and what we're seeing in the workforce survey is what they see and need as well. And Tim, to acknowledge and also agree with what your comment is, he says a lot of the childcare workforce were also traumatized during and after COVID. So that's something that we'll need to address in the future to help us get a better consistency with staffing. And 100,000% agree, because we can't silo out the workforce from the families, because the fact is that most of the workforce in childcare are these families. So we can't silo that out. This is a workforce need and this is a family need. This is a need across the entire state of Texas, especially with anyone who has young children. And to make that really clear that a lot of the workforce are these families. And especially when we look at the demographics of the workforce. All right, are there any questions or comments? Well, to switch total gears here, let's go ahead and go into the next slide, Cindy. And so I'm going to skip this slide. You can go to the next slide, Cindy. So to completely switch ideas here, I want to talk about data needs across the systems, and some of the things that we see specifically related to data needs that we're hearing coming through the workforce, our coalition work, and also our conversations with the different state agencies happening. Go ahead and go to the next slide. I want to acknowledge that on the state level, kind of the work, any data sharing and data integration, that work is going. And so I'm not representing anything here that is going to change that trajectory of that work, nor do I want to change the trajectory of that work. Because I actually find it really awesome and exciting, and I'm so excited to see what this integrated data system and data sharing looks like moving forward. But I do want to point out that there is a difference in what we're hearing at the local level versus the direction the state is going. The state is really focused on data sharing and integrating so that they can answer questions related to unique families served and questions of the types of services that are being accessed by families. On the local level, we hear a slightly and subtly, but importantly different question related to data sharing and integration. They're really focused on questions of how families move between services and questions of referral source and uptake. So they're looking at how the system is functioning and trying to integrate data to understand how the system is functioning locally, whereas the state is looking at questions of, are we doing our job? Are we serving families? What kind of services are our families receiving? And so go to the next slide, Cindy. And part of that is there's these two different pressures happening at the state and the local level. And at the state level, these data sharing and integrating data systems questions really focus on reporting, which there's nothing, it's not a criticism, it's an important. I was an epidemiologist for this state. I know how incredibly important this is and how hard this is, that the federal reporting, the state LBB reporting, the other reporting that has to be done. You guys need this integrated data system to be able to do this reporting well. But on the local level, they need integrated data systems for a different reason, and they want it for family service improvement. The other thing that we have to acknowledge is that integrated data systems and understanding how families move between services are a requirement for Help Me Grow fidelity. So when local organizations and coalitions are filling out their Help Me Grow fidelity, they're being asked questions about, hey, did that referral work? How many referrals worked? How many families moved to that service? How many families did this? So they're looking at this from a different lens than where the state is looking at it. And I just want to acknowledge that and say that out loud. That these are two different issues. And I also think that they require two different solutions related to the needs that are happening at the local level versus the needs that are happening at the state level. So I just want to say that out loud. And that's the big takeaway on data sharing and integration needs. Go ahead, Sarah.
Yeah, I just want to say, I'm not sure that I totally agree that the state is not interested or not working on some of the issues that you've listed as local issues. So
I'm just taking that from what the data governance requirements and the persona requirements are of where integration is going to move, is where integration is moving right now based on the reports that I have are really going to answer these two major questions. So yes, I know you guys care about those other things. I really know you guys care about those other things. I'm doing
well,
a
not just
project.
about our feelings, but also
Yeah.
that there's like active work happening, especially the referral source and uptake. I agree that that may be something that's more of a local question. And I do think sort of our state level work with Help Me Grow and other kinds of centralized sort of no wrong door approaches is part of how we manage that. But the question of how families move between services, about which families are accessing which services and when over the course of their journey is for sure it's like a legislative requirement. It's not just because we care about it. So I just want to say, I think the layers are more blurred than this slide indicates.
I agree, and I think at a ideal situation, there shouldn't be a difference between this and the way that many of you have talked about the want for integrated data systems. Definitely wants to move in that direction of questions of how families move between services. What I'm saying is that to answer those questions right now with the state data system, the amount of people like me that are needed to answer that question is really, really high, as opposed to that data system that is opposed to where the state is going with integration right now. I think this is multiple steps down the road for integrating. At the local level, this is what people are asking me for now. Does that make sense, Sarah? Like the rest of it, like they're not asking me about how you do this. They're asking me, how do I find out whether or not my family went into that service or not? And so this is like the gap that Find Help is trying to fill with local organizations. So it's something that can be done with the state level data systems, but it's not necessarily the journey that the local organizations are talking about are not necessarily the journey that you guys are talking about. And I just want to put that out there. All right, are there any other questions? So Cindy, you can go ahead and end the presentation. Are there any other questions or comments?
Dorothy, is this the last of the initials? These are the 3 prongs, right?
Yes, this is the last of the initials. And so where we are right now is we're actually writing the needs assessment report. So when that goes through all the approvals, then we'll have the needs assessment report that will be out to y'all. And based on some of our conversations and discussions, we've been moving towards little bit more nuanced analysis within the needs assessment report that we should be able to give you guys, not just the more descriptive approach that we have been taking within these webinars.
Great, thank you.
Thanks. And so Megan, Lynn is asking about the timeline for the report. I think that's something that we can answer later, because I'm going to be honest with you, those dates are not at the top of my head.
Yeah, it'll be, I mean, it will be publicly posted by the end of this year and complete for the first round of pulling everything together. I believe it's in October of this year. We'll definitely keep sharing out updates in these forums of the Texas Rural Learning Council. And then just a couple pieces. Thank you so much, Dorothy. This was awesome. A couple comments that came throughout. I don't think we have to address them now, but just wanted to point out folks were interested in earlier in your deck where you had some information about rural versus urban, et cetera. How much of an ability there is to break down things like the ideal childcare setting, you know, in those sorts of ways.
That is definitely an analysis that we'll be including in the report, in particular, because one of the things that we're seeing hints of that I would like to analyze a little bit more closely is a bigger gap or a bigger impact related to rurality and ruralness, and whether or not there is a child with a disability or a delay. Which is probably no surprise to anyone. But that's something we definitely want to look at. And then the other thing that we're also looking at related to geography with the family survey in particular, because we can, is actually starting mapping it back on to other data that we have available for geography, like childcare deserts, for example, and also some other work that we have around different early childhood risks within the communities as well. So that is something that we are working on putting into the actual needs assessment, as opposed to presenting just general state findings here.
And then the only other one, this is a smaller point, but I just wanted to make sure it didn't get lost, was a question around your pre and post-COVID family perceptions, and whether there's a way of knowing how much of making less money is due to a choice not to work after COVID versus losing a job.
We didn't ask that, so not sure. Yeah, we didn't ask that. So.
Awesome. Well, I'll open it up for anyone else. Any final questions or comments?
I on the one slide you showed that a lot more children were identified during COVID that have disabilities. And could you didn't mention anything about that as you talked about the slide. I should have popped up then and asked, but do you have any reason why that was the case? Is it just that parents had more time to take them in for services or to get checked or what?
That is 100% a function of the age of the kids. All these kids are going to be diagnosed with COVID during COVID during that time, because all of these kids were at that age to be diagnosed during that time. So it's really 100%. That's why I glossed over it and didn't talk about it, because it's more of a function of the survey and how we ask the question than it is something about it was a higher identification during COVID. I actually considered taking that off the slide and probably should have, but it's just 100% a function of the age of the kids.
Thank you.
All right, well, thank you, Dorothy, for a great presentation, and thank you from council members for your engagement and thoughts. We will move on to our last couple agenda items. So updates from Texas Early Learning Council members. I'll share an update about Friday's strategic planning meeting. So we're going for some records here and trying to pack in as many Texas Early Learning Council member meetings in a small amount of time as possible. So I realize we're asking a lot of y'all in particular in this week. So I know usually you have to wait a little longer between meetings. You won't have to wait long. So we'll see those of you who are able to come in person for our second strategic planning meeting on Friday. And just as a reminder of where this fits in the context of the rest of the strategic planning meetings, there are 3 of them total. We did the first one on July 10th virtually. Kate McCurley from UT facilitated that meeting. She and her team will also be facilitating Friday's meeting, which is session 2, September 15th, as well as our session 3, which is on October 5th and 6th. So our July 10th first meeting was to focus on defining our scope. It was fairly content agnostic. Our Friday and our sessions 2 and 3, we will follow the structure of the needs assessments that Dorothy has been presenting with us. So strategic planning session 2 on Friday will focus on workforce and coalition needs. So if you weren't able to attend those meetings, or maybe you need a refresher because they were earlier in the summer, we'll be resharing the links to that information as well as to the first strategic planning meeting in case you missed that one. The third strategic planning session, October 5th and 6th, will be focusing on family and data needs. So that's what we heard about today. So save the information you heard today and we'll pick it back up a bit more in October. So your homework prior to Friday is just to watch the webinars if you missed them about the needs assessment findings from Workforce and Coalition, as well as complete any pre-read items that Kate sent. So she sent out a package of materials this past Friday. And then if you aren't able to attend, which we know in person is tricky, and a lot of y'all are not able to attend. So thank you to those who are making the trek into Austin. And thank you to those who aren't able to attend and have designated representatives from your organizations to attend on your behalfs. So as a reminder, for those coming in from other places around the state to Austin, if you're planning on traveling and you would like to be reimbursed for that travel, so whether that's your mileage, rental car, your hotel, or even your lunch that day, Cindy's been in touch with you about information that she needs, and we will need at least the initial kind of direct deposit form from you by this Wednesday, September 13th. So we'll send out a reminder to everyone who we haven't heard from that has confirmed they're traveling in, but just wanted to say that out loud because we want to be able to reimburse you, but we can't do that unless we get the right approvals in place up front before the meeting happens. So I'll pause there for a second, and then the address is listed here. It is at the Austin South Park Hotel, 4140 Governors Row, just on the south side of town. Any travel, well, not any travel logistics questions because I don't want to use up the rest of our time with that, but any general questions about what's expected of you for Friday. We're really excited to see people in person. And then one more note on this for all the wonderful 50+ attendees tuned in. This will be run as a public meeting. It will be different, obviously, than our normal virtual meetings because it will be in person only. So the details for the meeting are listed in the same place as you always find information about this meeting. So earlylearningtexas.org. And the address is there. It will run from 8:30 to 4:30 p.m. For anyone who wants to come, you are welcome to come. We'll have the opportunity for public comment. Just email me in advance if you'd like to give public comment. And then the entire day, we'll have it set up so that if you're a member of the public attending, there will be an audience space for you to watch. So let's run on to the next slide. Thank you, Cindy. Any other updates from TELC members? And then we will have an events is the last item after this. So any general updates from TELC members you'd like to share? Okay, Stephanie.
Hi. I'm actually going to let Sarah go first because I love hearing from Sarah, and then I'll go.
Uh-oh.
Because I talk all the time. So Sarah, I'm punting to you because I'm
Punting to me,
excited you're
okay.
here today.
Well, I'm gonna save one of my announcements for the events section, but I do want to highlight that as a part so in our most recent legislative session, as a part of and connected to Senate Bill 24, PEI as it currently exists is going through some pretty significant changes. One of the most significant is that we are working on moving all of the work that is currently happening under prevention and early intervention from the Department of Family and Protective Services to the Health and Human Services Commission to be housed within their Family and Health Services Division. That is underway now, the transition planning and working, even though the formal move won't happen until September 1 of next year. But a part of that is that we did receive some additional funding in our early childhood work, and specifically in some of our home visiting work. And our latest request for applications was just released last Friday, to help expand our reach with evidence-based home visiting practice and models that are currently funded through a mix of state dollars and maternal, infant, early childhood home visiting grant funding from our federal partners. So I'm going to drop in the chat right now the link to the public announcement for that RFA. And there's a geographic limitation. We're really looking to support programs that are in communities not currently receiving these dollars for evidence-based home visiting. And so if you are in one of those communities or know folks that are, that might be interested in making this available to families in those communities, we encourage you to take a look. There's an upcoming webinar with more information, and also in this link, a place to reach out if you have any additional questions. Stephanie, I'll turn it back over to you.
Thank you. So I posted a couple of things in the chat. One is a new blog by our wonderful David Fagan on the Texas School Readiness Dashboard and the policy changes from this legislative session that were recommendations in the dashboard. So that hopefully is useful. We are in the process of updating the dashboard with updated state data and also some local data where we can get it. And we're working with Cynthia Osborne's team on both of those fronts. We have a new research director who's working with David on that, which is great. And then the other thing I put in the chat is obviously there's a lot of concern with the Medicaid quote unwinding, or families getting kids and families getting redetermined as the public health emergency has ended, and the thousands, tens of thousands of kids who have been removed from Medicaid, in many cases without eligibility actually being determined, but for kind of lack of response or barriers to signing, getting in to answer questions and so forth. So there is a number of groups have organized sort of virtual town halls so people can ask questions and get information. So more info will be on the Stay Covered Texas.org website. I don't know if it's up yet, but that's a useful website for folks. And then the last thing I just want to say, and I would love it if we can invite her at some point to give a presentation, but the Early Childhood Caucus in the House has a new staff director, Brianna Menard, who's fabulous. So be great to be able to hear from her. And of course, her boss, the chairman and vice chairman and others at some point. So we're really excited for the caucus to be active this interim. Thank you.
Great, thanks so much, Sarah and Stephanie. Any other updates from other members? All right. Take us to the next slide, please, Cindy. So the same upcoming events as we shared about a month ago, but they're all a little closer. So I will let folks who are familiar with any of these just jump in and come off mute if you want to highlight one of these events that you're involved in or helping promote.
Megan, I don't have an update on these specific events, but did want to update that everyone should be getting an email from your inbox shortly, or by the end of today, about the Texas tour dates. We will be out in 12 communities in October, talking about childcare, talking about session, talking about PN3, and talking about Prop 2. That is going to be available for everyone to vote on in November. So, which is the property tax for childcare centers relief. So look for those dates. We'll be hitting 12 communities in 3 weeks. So we'll be in a community near you. So, yeah, June exactly. So pray for me in October. But we look forward to being out in community and hope everyone can join us when we go out to your community. That's it for me.
And this is Sarah. I just want to highlight that our annual Partners in Prevention conference, which, I mean, you know, I might be a little biased, but I think is an amazing place of connection, education, and information sharing and brainstorming among prevention-focused professionals and caregivers and parents, is coming up in November. This is the week before Thanksgiving, but we are really looking forward to it. And public registration just went live. I saw that Megan put the link here in our chat, and we have some really amazing speakers and sessions, and we really encourage you guys to take a look and join us in Austin if you're able.
Awesome. And thank you, Alperma. And Cindy added that to the chat. Texas Head Start Association's virtual leadership forum on September 14th. So this Thursday. All right. Well, thank you all for a lively and engaging meeting today. I look forward to seeing, if you want to go to the last slide, Cindy, we look forward to seeing those of you who are able to make it in person this Friday, September 15th from 8:30 to 4:30 p.m. at the Austin South Park Hotel. And we will adjourn this meeting. It is 12:57. And thank you so much again for your time.
Thanks, Megan. See you guys Friday.